All right. So, a very warm welcome to everybody, and welcome to the live session conducted by the Happiness Studio and CFAR IVF Clinic. Today, we have with us clinical and a senior gynecologist and fertility specialist, Dr. Puneet Arora. Welcome to the both of you, ma'am. And yes. And Dr. Bhavna is an internationally well-renowned practicing child and clinical psychologist. Ma'am has had more than 25 years of experience successfully treating her individual clients as well as conducting group workshops for corporates and educational institutes. Ma'am has also been an expert for multiple print and electronic media, and we have a plethora of awards credited to her. We welcome you, ma'am.
Thank you so much. My complete pleasure being here and sharing the platform with one of the most esteemed people in the field of the health topic that you're going to be introducing all of us to today, Nitya.
Yes. And we also have Dr. Puneet Rana Arora, ma'am, who is the best IVF expert in Delhi NCR and is the founder of CFA's Center for Infertility and Assisted Reproduction, and has had an experience of more than 20 years in her field. Ma'am has worked for over a decade in National Health Services in UK, providing care to infertile patients. Ma'am is an empathetic and sympathetic doctor who firmly believes in delivering quality and evidence-based care. Puneet ma'am is one of the experienced, dedicated, and best fertility specialists in Gurgaon, India. She tries to keep pace with the current developments in reproductive medicine and provides latest and advanced treatment methods to her patients. We welcome you, ma'am.
Thank you. Thank you so much. And pleasure for me indeed to touch on a very important topic in both the specialties, in psychology as well as infertility.
Yes. So to begin with today's live, ma'am, we have a few questions for our clinical psychologist as well, ma'am. So to begin with the first question, Puneet ma'am, we wanted to understand what the IVF process is.
So IVF stands for in vitro fertilization. When the baby is formed inside a mom's tummy, it is a fusion of eggs from the female and sperms from the male, which lead to embryo formation. This is a process of fertilization, but this happens in the body in vivo. When the same process happens outside a female body, in the embryology lab, it is called as in vitro. So we are handling sperms, we are making them fertilize to make embryos, and then transfer those embryos back into the female uterus. So this is all about IVF or in vitro fertilization.
Wow, that's amazing and complicated and stressful at the same time, ma'am. So my next question is for Bhavna, ma'am. Ma'am, do you think there are any physiological and emotional impacts of IVF on the patients undergoing the treatment?
You know, I think the most important emotional impact is that IVF gives us as parents a ray of beautiful hope. And I think that hope is so nurturing. It builds up the maximum number of endorphins because it gives us the hope of creating a family. But yes, the process of IVF is physiologically taxing, but we are ready to do that because we know it's a beautiful journey that we're getting onto, and thereby it can get emotionally sensitive and make us vulnerable as well, because there are a lot of treatments that happen, like the hormonal treatments, the invasive procedures, and the emotional roller coaster, which starts with hope, and sometimes there are disappointments, but it comes back with hope. So there is a transition which does cause stress, which may further exacerbate the challenges of infertility. So what is very important to note is that in case we are able to keep our bay or our stress at bay, then of course the transition into fertility becomes easier. But we do experience real-time challenges like miscarriage or failed IVF cycles, which do lead us to disappointments. We sometimes may mourn the loss of our imagined family or the loss of being related if the donor egg, sperm or embryos are used. And these losses aren't always visible to others. but it may add to your grief. And moreover, infertility and the treatment itself causes some amount of anxiety in the patient due to even the societal pressures, the family pressures, and the concerns over the process. But I think if you have a good gynecologist and Dr. Puneet with you, the journey just becomes very, very easy and hopeful and beautiful.
Right. Ma'am, you were talking about, I mean, that brings us actually to the point that there are a lot of myths and stigmas, like you mentioned. So, Puneet, ma'am, do you see these myths and stigmas when patients come and meet you?
So, yes, I think we do see a lot. In a way, the biggest myth, not the stigma, I would say, I'll cover both separately. The biggest myth is when they walk into a fertility clinic with their infertility, they think they will be offered IVF only. And like Dr. Bhavna rightly said, it's not. IVF is one of the treatment. There are a lot of other things which a fertility clinic can offer, like hormonal treatment, IUIs, maybe a laparoscopy, where the fertilization is happening. So I think they come with a mindset, and sometimes they don't come because they feel that they will only be offered IVF, and they miss that window, the narrow window where if they get treatment, right treatment, maybe they don't need IVF. So I think that window is very. But like I said, the world is changing. We are seeing a drift. We are seeing a change. Like what we are doing, the awareness thing. Our patients are getting aware. And talking about the stigma, again, a lot of our patients don't want to share the journey, what they are undergoing. In case they refer their relatives, they may say, okay, doctor, we are sending a patient, but please don't tell that what we had. So they want to be open, but still there is somewhere in the back of the mind that they had the baby with some assistance. So I think those stigmas can be, if we are more open to them, if we support them initially with all the appropriate counseling needed for the treatment. And hence, that's why the psychological counseling is paramount importance when in a fertility clinic and when.
Absolutely, ma'am. I agree. And for Bhavna, ma'am, my question is that, when all of these patients go through this process, they have stress. So how do they deal with all of the pressure?
I feel one, they already have the stress of the procedure itself, like Dr. Puneet very beautifully explained. And then it gets coupled up with the infertility stigma, which definitely can bring intense mental pressure and psychological burden, especially to the female infertility patients, and affect their quality of life. In our Indian society, where gender roles and social status are intrinsically tied to parenthood, childbearing is of immense importance. And this value that has been put on being able to birth a child is so inflated that most often, sometimes we see the sole purpose of marriage is to grow the family and to keep the generations going. But yes, we do have an urban India, and we do have people like you, me, and all of us who are working to breaking this. In fact, sometimes even being seen going to an infertility clinic is seen as being disappointing, being embarrassing. The societal pressure to have children via the infertility setups can be very, very challenging. And that is why, on the occasion of having Baisakhi tomorrow, Dr. Puneet and myself are extremely proud of announcing that we are starting support groups which are going to be for our to be mothers, support groups that are going to be for our to be fathers, and support groups for couples at large. So we are going to open the registration from tomorrow, where each one of you who's gone through this process or going through this process are more than welcome to be a part of it. And there would be 3 different days that we would let you know at CFAR, where you can come and you can share your story. And that will definitely aid each other to make our journeys even more beautiful.
Absolutely, ma'am. And Puneet, ma'am, so family also plays a very important role, and each patient also requires the support of their family. So, in your words, can we understand how family plays a role in the process that you treat them?
Yeah, I think where we are sitting in India, we do believe in the familial support system. But what I have seen in the clinic, like I see all kind of scenarios where with one couple, everybody walks in, be it the parents, be it the parent-in-laws, maybe sister-in-law, and other spectrum where only husband and wife in, and they just don't want to tell anybody. So we get both extremes. But what I have seen is personally, and this is my evidence of seeing the patients, it should be a balanced support of the parents. They should support what is needed, but not too much interfering with the treatment. Because somewhere down the line, they do feel that it is an artificial treatment and they may put away the children from getting that treatment. So I think that support and that delays the treatment, and we know that even a slight late delay in treatment sometimes can affect our outcomes. So I think approach. They should provide support, yes, very important. More mentally, any advisory role in what the treatment they should have.
Absolutely agreed, ma'am. So, Bhavna ma'am, we have our question ready. How can families support them mentally?
I think Dr. Puneet answered it very sensitively to us, that I think each family needs to acknowledge that there are various processes that involve, that are medical intervention. And we need to see this as a medical intervention because it is starting a new journey of life for you, thereby acknowledging it as a medical intervention, being empathetic with the couple and especially the mother who's ready to go through the procedure, and providing the positive coping, the positive strengths and the supports that the couple needs, rather than the family members using negative coping techniques such as blaming, side taking, denial, avoidance, lack of acknowledgement, etc., etc. So I think, like we were just mentioning, we need to have support groups. I think another support group that we need to add is the extended family of the couple, because the more they are aware, the more they will be able to share. And they definitely, in India, we have beautiful family systems, and when the family is together, it makes it a wonderful journey together.
Absolutely, ma'am. I agree. For our last question with Puneet, ma'am, we wanted to ask you, do you think that mental health counseling in a way helps the IVF treatment?
I would say very, very strongly. I'm a firm believer of that, and that's why we are working together. Because, I mean, again, infertility per se or IVF can be mentally, emotionally, financially, and it can be taxing in a lot of ways to a couple, especially for the working people as well, because it does need a commitment. The treatment involves various procedures which need time and commitment. So it's not only about that, undergoing the whole also gets emotionally the patient gets very much emotionally attached to this treatment, and they start it with a hope and happiness that they will achieve it, because some couples do think that this is the last treatment option they're having and they will achieve success in it. But we all know that have limitation. It's a science. Not everybody gets 100% in one cycle. It may involve repeated IVF treatment cycles. So I think that understanding of the process, understanding of that realistic hope which they have come with, it's very important that it is hand-holded by a clinical psychologist. We as clinicians, we do it, but it's a teamwork. What clinical psychologists can do, I don't think so a clinician can do it. And that's why this journey has to be, for the patient, has to be in a teamwork. And that's why we do ensure in our clinic that when a patient walks in, one of the first things they do is fill up the mental score. Not exactly mental, I would say, but their level assessment score to find out what is their baseline level of stress, anxiety, and depression. Is it a general thing, or is it because of the fertility, infertility? So we try to understand their underlying, mental health. And I think that really helps us to handhold them rightly and make their part in the right direction. So yes, I'm a very firm believer of inculcating mental health, the clinical psychologist with the fertility treatment.
Absolutely, ma'am. And I have come to CFAR and I have seen patients fill up the form, and I can say with a surety that it definitely helps.
Yeah.
So thank you for that.
Nitya, I add on to that Dr. Puneet, using such a beautiful and holistic approach at your center and of course at the Happiness Studios as well, as clinical psychologists, I think we use what we call as positive psychotherapy with each and every person coming into this cycle of evolving into a family. And I think when you start as a psychologist to help them see the silver linings in the dark clouds, and they see that there are so many silver linings because there is so much medical intervention that can create a bowl of silver, not just silver linings in their life. It is a very good beginning, because genuinely a lot of patients that we see in the infertility centers and at CFAR come in with anxiety, stress, and depression. The basic is to make them understand that this has an impact on their treatment process. It is inversely proportional. So we teach them, we guide them through basic relaxation techniques, breath work, coping mechanisms to be self-sufficient. They go through couple counseling if required. How each family member can support them is through family therapy. And in our counseling room, we address concerns of each and every person who's coming to us, especially the parents to be, one step at a time. And the very basic first step is to walk into our well-being room at the CFAR clinic. So we encourage each one of you to do that, so that the transition into whichever phases of life you're moving into becomes very, very smooth sailing. And we as a team are committed to handhold you through that.
Absolutely. And I encourage every participant coming into CFAR, every patient coming to CFAR, to walk into our counseling room. And we thank you, Bhavna ma'am, and we thank you, Puneet ma'am, for such a motivating talk and answering all of our questions from the audience. So thank you.
Thank you for having us here.
Yes. And we, as Bhavna ma'am says, the live session ends here, but our relationship extends to the end. So if there are any questions that anybody would like us to answer, you can drop them in the chat box and we will be happy to answer them for you.
And we look forward to see more couples who are having this treatment to come to the support groups. I think that will be very useful, what I can say from my experience in working in this field for long now.
Yes.
And I validate that completely. And we invite each and every person over here who's going through the infertility treatment to be a part of the mothers group, the fathers group, the couple group, and the extended family group. Let's work hand in glove to give the best well-being to the new baby coming into our lives. Thank you so much for each one of you to be present here today.
Thank you.
Thank you. Thank you.